Hello, everyone. Dr. Karen Can here, and I'm doing a brand new series. This is video one of a brand new series that I am calling Common LifeWave Mistakes or the LifeWave Common Mistakes series. I'm not sure exactly what I'm going to title it, but anyway, the reason I am creating this new series is because I have found that whether it be a LifeWave customer or distributor, sometimes similar issues come up over and over again. And in my other series, which is the LifeWave micro training series, is really about like advanced but simple protocols for certain symptoms. In this series, I'm going to be talking about some of the common mistakes that people make that prevent them from getting the most out of their LifeWave patches and or the business. So some we'll have some crossover between like being customer and business patching. Other mistakes may be more for business people, so I'm just letting you know ahead of time if you are interested in this playlist. In the future videos, I will be posting the playlist. It's not made yet because this is the first video, but we will be putting a playlist together, and you can, of course, follow the playlist and certainly subscribe to my channel on YouTube as well, Karen Can. And so today we're going to talk about one of the most common mistakes that people make when talking about LifeWave patches and what to use them. So one of the most common questions that we get is, well, I have such and such a condition. What patches do I do for that condition? Okay, so let me give you an example. Somebody might say, well, I have lupus. What patches should I use? Okay. Or they might say, I have high blood pressure. Which patches do I use? Do I use the Eon patch? Do I use the energy enhancer patch? Things like that. Now, first things for you to know is that LifeWave does not cure, prevent, or treat or claim to do any of those things. And in America, we have the Food and Drug Administration, the FDA, we have the FTC, the Federal Trade Commission, which forbids companies from making claims to treat, cure, prevent any disease or medical conditions unless you happen to be a pharmaceutical industry and gone through all those hoops, things like that. That being said, LifeWave patches have been shown to be extremely helpful and clinically proven to um, to help symptoms. Now, does that mean that your body can't heal itself if the symptoms are getting better? It probably can, right? So when you cut yourself, what heals it? You heal it, right? But is it possible that if you get the right energy and the right frequency, that you could heal faster? Yeah, possibly, but we can't make a claim, right? So when people, and this is for LifeWave distributors, okay, when people ask you, I've got multisystemic, whatever, autoimmune disease, or I've got scleroderma, or I've got prostatitis, or I've got osteoporosis, right? And you're like, oh my God, I have to be a medical doctor to do this. Right? Like, what patch do I use? So we used to get so many questions like this. I say used to get because people on my team are getting better and better trained at asking the right question. And in the past, what I would do is go, well, yeah, as a medical doctor, I know what the symptoms are. So here, these are the patches for the symptoms. But now I'm going to be much stricter, much stricter. So when a team member asks me, what do I patch for rheumatoid arthritis? What do I patch for sciatica? What do I patch for some sort of condition name? I'm not going to answer them. No, I'm going to turn around and say, okay, you give me the diagnosis. What's the symptom? Right now, some of people will be like, what? Like, don't you know? Well, it's like, hey, we have to be really, really strict on this. Okay. We love LifeWave patches so much. We do not want to get the company into any sort of trouble with any of their distributors claiming that they treat a disorder, right? So that's why we're super strict on this, especially these days. So you have to tell me what the symptoms are. Okay. And this can go on several, conversations. So I'm going to be really strict on this now going on. People ask me these things. My team members know better than to do that, but I do get lots and lots of emails and messages from, people and teams all over the world asking similar things, and even medical doctors, and healthcare practitioners saying, hey, just between the two of us, what patches, should so-and-so be using? They've got such and such a disease. And I'm like, I'm not answering that question. Sorry. I don't care if it's private message or email me on Proton Mail. I'm not answering that question. So, how can you get the right question? So, the wrong question asked is, what patches do I use for such and such a medical condition, right? Don't use that. Now, if you're a distributor and somebody asks you, hey, my husband has a degenerative disc disease. What patches do I use? What you say, listen carefully. What you say is saying, well, it doesn't really matter what the medical condition or the name of whatever is going on is. What are the symptoms? Right? You'd be surprised at how many people don't know what a symptom is. Okay, so they're like, well, he has herniated disc. That's a diagnosis. What's the symptom? Well, the disc is herniated. That's not a symptom. Is it pain? Is it swelling? Is it not being able to sleep at night? Is it all of the above plus stress? Like, what is the symptom? And they're like, oh, well, he's got pain going down the leg and it's really bad where his foot is. The foot is burning. Aha. Okay. We've got the right patch for that, right? So you're looking for the symptom. So if somebody says, well, it's pain, all right, what do you think of? Okay. So when it's pain, you have several options. First, you have our LifeWave patches. LifeWave patches are known to treat the symptom of pain very quickly, actually, within minutes for most people. My experience, about 80% of people get, better, at least 50% decrease in pain within minutes using the protocol that's in the brochure. The other 15 to 20%, you may have to finagle it a little bit, use different protocols. The person might need to hydrate more, anyway, I can go on another video about all that. But for now, so we're giving this example, right? So pain, what do you got? We got LifeWave, okay? Known for pain. That's what it treats. What else do we got? We have Eon patches, known to decrease stress and inflammation. Is there inflammation with pain? Yeah, usually there is. So that is another option, right? What other option do we have? Well, we have X39, stem cell enhancing patches. That's been known to also decrease pain in a significant number of people. And this is just a single patch, even easier to use than X39. Maybe or maybe not right away, like not within minutes or seconds, like the LifeWave. But this is the nice advantage of it helps your body heal itself through stem cells. So enhancing stem cells. So if somebody says, well, I'd really like to get rid of pain. And if there's any way that, if they even say, can this cure it or can this treat it? You can't say it treats it, right? You can't treat a condition, but you say, well, activating healthy stem cells in your body can help your body rebuild itself. That is a claim you can make because you're not talking about the patch. You're talking about your own body's ability to rebuild itself. Yeah, the patch helps you make stem cells, which then goes to rebuild the body. So if somebody has a goal of not just pain relief, but actually maybe repairing or regenerating or rejuvenating the body, then X39 might be a good addition. Okay, so let's do another example. Somebody says, my cousin's got depression. What patch is good for that? So you're going to practice say, well, okay, so at least you know the symptom, right? It says, well, we can't claim to treat, cure, or prevent any illness with LifeWave patches, but we do have some patches that may help to increase the mood or elevate the mood, or decrease stress. Would that be helpful? Person says, well, yeah, that'd be really helpful to increase mood, in a happier mood and decrease stress. Those are, two really good ones. Then what do you think? Now, I know some of you are like, I know the answer. What patches do we have to elevate mood and decrease stress? Well, we already talked about the decreased stress one, right? So Eon. So somebody has severe stress in their life, and a lot of people would quickly admit they have severe stress in their life. Think Eon. Okay, this works very fast. Within 10 minutes, you can see on instrumentation in the research that the brain and nervous system goes back into a balanced state within 10 minutes. Like, holy schmoly. Amazing, right? So you had that. What else do we have? We have Nirvana. Nirvana elevates mood through beta endorphins. So clinically proven to increase beta endorphin production in your body. And all LifeWave patches don't use chemicals, drugs. You can put it right over clothing and it still works. You do have to hydrate though. So you do have to hydrate and, have a decent diet. So at least you have protein, right? So if you're, really like, if you're on like, I don't know, water diet for 30 days, I don't know if it's going to work as well. Of course, you still have protein in your body that you can break down to make new proteins, but basically, you want to drink lots of water, right? You want to drink lots of water for all the patches to work. All right, let's take another example. All right, let's say somebody has anxiety. Okay, anxiety is considered a disorder or medical condition. So, okay, like anxiety. Well, what's their symptom? Anxiety. I know it's kind of a symptom, but it's also a diagnosis. So you have to reword it a little bit. What happens when you're anxious? Well, I feel like the world's going to end. My heart is beating quickly. My skin gets kind of like, my mouth gets dry. Like I just feel on edge, right? I have tightness, right? Those are some symptoms. Somebody might say, I have belly pain. So there can be a bunch of symptoms. So you want to listen to the symptoms. So someone says, I feel really, really nervous and super stressed out. And it's just like I'm high alert. What does it make you think of? Stress, right? Stress. What do we have for stress? We have Eon. We have Eon for stress. So yeah, so that would be good, right? So someone is on that, you know, right? That tenseness. We can't use the word anxiety. We're not treating anxiety, but we're treating the symptoms of anxiety. So nervousness, heart's beating fast. Your mouth is dry. You feel like something bad's going to happen. You're tight. You're tense, right? Eon's very, very helpful for that stress response. And this is in my micro training video, but I do have, in the severe cases, I do have a double Eon protocol, one behind the ear, one patch behind the ear, and one on the belly button. Okay. If you're in emergencies, you want to balance the nervous system really, really quickly, you can use 2 Eons. So you can check out my micro training series on different protocols for that. Okay, let's do another example. Well, say someone says, well, my dad's going to have surgery. What patches would be good before and after surgery? So in this case, well, they may have a symptom, but they're getting surgery for it probably. So the other thing you can ask besides what are the symptoms, okay, is what's the person's goal? So then I will say to that person, okay, well, let's go in for surgery. What's your goal? What do you want to happen here? Well, I want them to be safe after surgery. I want them to heal faster. I want them not to get a cold after surgery. I want their immune system to be good, right? So these are very varying options. So somebody might answer very, very differently when you ask them what their goals are. Now, I can assume from being a medical doctor what they're looking for, but it's much better unless you're a medical doctor to ask specifically about what their goals are. For most people, it might be, well, I just want that person to do really well and surgery not have complications, right? So in that case, I would be like, okay, so that's your goal. What we want to do is support the body and the immune system prior to, during, and after surgery. Now, during, maybe they won't let you wear anything on your body, even though it doesn't interact with anything. Probably would be really helpful during surgery to have patches on. But in case they want you perfectly naked, bottom to top, then you may not be able to use that until afterwards. So if someone has a planned elective surgery, non-emergency surgery, and they said, I would like to have the best possible outcome, I will build the body or help the body build up before surgery. So in that case, I might be like, okay, we want to make sure that you are not stressed, because when you're stressed, your immune system goes down and you're not sleeping. You can't repair your body if you're not sleeping well. So what am I going to reach for, guys? Eon, right? Eon for stress. Okay. And then what else? Well, what else can help your body build itself to be strong? Well, there's X39, right? The stem cell enhancing patches. That would be really helpful before and after surgery. Why after surgery as well? Because it helps wound repair really well. It really helps with wound repair, skin repair, scar tissue remodeling. So that would be helpful before surgery. What else? Well, we want that energy system to be high, right? We want the adrenals, we want the chi, the energy to be higher before surgery, because surgery is a major stress and you basically go down in energy with surgery, and then you got to build back up to some degree, right? So energy enhancer patches. Yes, we haven't talked about this one yet. Energy enhancer patches helps you make more energy through burning fat. And again, clinically proven to do that, helps your little mitochondria be happier. So this would be something you may want to do before and after surgery. What else? Well, you say, is there anything else that we can do for wound support and scar tissue modulation and making sure the person, say they used to have keloid scars, maybe is there a way in which, we can have the repair better? Well, we have carnosine patches. So carnosine patches help with tissue repair. And so if somebody has damage in their bodies, in addition to X39, the stem cell enhancing patches, this is complementary. So after surgery, it might be really good to do, carnosine, X39, Eon, and possibly energy enhancer patches for a while until they get back on their feet and feel really good. What if they want pain relief? Well, you already know that X39, Eon, and LifeWave are helpful for pain relief, right? But you might want to specifically use the LifeWave in and around the area that was surgically, worked on. If somebody says, well, I had surgery, but there's a cast, put it on top of the cast. It still works. Make sure they're hydrated. It still works. Okay. So let's take another example. Well, this is very similar. So say someone says, hey, my loved one is going through chemotherapy. What patches can support them, to do well through that? Now, we know with chemotherapy, it's fairly toxic, right? So it's going to, the immune system is going to get a major hit. And the funny thing is and ironic, isn't it, that the immune system is necessary to clear cancer, but we're actually going to give chemo to kill everything, at least temporarily, right? So what you want to do is to optimize the immune system before and after. Here's the thing, though. One of the patches that we have, which you could also use this, if you want to, in the surgical scenario we talked about before. But one of the things you want to do in the chemo thing is, you may want to support a healthy immune system in all systems, really, your detoxification system. And how do you do that? Well, we have a couple of tricks up our sleeve. So the first one is we have the X39. Where did that go? Here it is. So X39, right? So X39 is a stem cell enhancing patch that's going to help a lot of different areas of the body, and that will help support the organs and help your stem cells regenerate your organs. Why? Because the stem cells get to a younger, healthier state. And besides, with X39, 1/3 of the genes in your DNA can revert to a younger, healthier state. That's pretty cool with GHK copper peptide, which is what this stimulates. You can look it up, GHK copper peptide. So you might want to use X39 before chemo. And before chemo, also to support the immune system, glutathione is helpful. That's your master antioxidant. Now, what we normally do, though, is because during chemotherapy, there's usually several bits of it, right? Like not just one. Usually have to do like a series. Oftentimes, we will wait until after it's done, completely done, before reinstituting the glutathione. So before you start chemo, you could do glutathione. After you stop chemo, you can do glutathione to detoxify, right? We don't know what the effects are if the glutathione, because it is so effective, and you're using chemo. If you're choosing chemo, you don't want to detoxify the chemo out of your system so fast, right, that it doesn't do what it's supposed to do. That's the theory. So I personally would suggest using your glutathione after you're done the series, after the series. Okay. And as far as X39 during the series, well, that's kind of controversial. A lot of people will say, no, it's, maybe it's better not to work on the stem cells until after chemo. Yeah, just wait. If chemo's 5 weeks, 6 weeks, whatever, you can wait until, so you do it before, right? As for hopefully months before. And if not, as much as you can, and then get your chemo. And then, afterwards, after the chemo series is over, then you can start your X39 and glutathione. What else can you use? Well, you can use carnosine, right? Because carnosine also helps with repair. And where'd it go? Repairing your organs. There we go. I should put these in alphabetical order, right? So carnosine helps you repair. So that's something that you can use after, even during, probably that's fine. During chemo, after chemo. Now, one of the things I really love is energy enhancer patches throughout the entire thing. Okay, so before, during, and after to keep the energy up. And this is very safe to do. It doesn't interact with medications. and you don't have to worry about your glutathione levels going too high. So can you see these are like possibilities, right? So whenever someone gives you a diagnosis, turn around and ask them what the symptoms are. Because someone tells me, hey, this person's got lupus. Okay, well, there's like a bunch of things that could happen with lupus. So that doesn't help me. I mean, as a medical doctor, I know, yeah, it's autoimmune, there's stress, there's inflammation, the person's probably tired, blah, 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 right? So I can guess, better not to guess, especially if you're not a medical doctor, right? Go ahead. What is the symptoms of the lupus? Oh, she's really tired. Okay, we've got something for that. We've got X39, we've got energy enhancer patches, right? Maybe they say, oh, well, she's in a lot of pain. Okay, what do we got? We got Eon, we got IceWave, we got X39. So you see what I mean? So so don't fall into that trap of trying to, you know, patch for diagnosis. Go and ask more explicit questions. What's the actual symptom of that? Is it pain? Is it inflammation? Is it sleep problems? Is it energy? Do you want to repair your body faster? That's a goal. So ask for symptoms and ask for goals. That is my tip for today. I hope this has been helpful. Definitely go ahead and share this video with whoever it is that may be helped by this. And I will continue doing this on periodic basis, the common mistakes that people make around LifeWave. And I hope this has been helpful. Please comment below this video. Let me know if that's been helpful, and how that's going to change, how you do things, how you ask things, how if you're a distributor, how you work with your potential customers and team members. And if you are brand new to LifeWave patches, you don't know too much about it, and you're looking for a distributor, we'll put a link, near this video where you can go and get some help from either myself or my team members, and you can learn more about it. But if you are working with someone else, like, go ahead and just contact them, and they will be able to help you. All right. So I'll look forward to the next time that we get together and talk about the next common mistake. Until next time, bye for now.